Hey, boys and girls. All right, guys. This is part two of chapter 30 and going to be the last one that we're going to do. So we got a little extra spare time. Plus, we'll be doing our block exam this week anyway. So love to just get this PowerPoint out of the way. So that's great. So let's talk about basics of splinting. We've gone over, bone injuries themselves, joint injuries. Now we're going to talk about how to splint. And you guys are working on some of that stuff. I've seen some good information coming across so far. Okay, so splints are used to prevent movement of bone fragments or ends or dislocated joints to reduce further injuries, reduce pain and chance of complications. So the reason for putting splints together is to make sure that we minimize the pain. One of the things people don't recognize, it minimizes pain, and it also prevents us from having any further complications because bone ends are moving inside there if it's not splinted and immobilized properly. Complications include damage to muscle, nerves, or blood vessels, conversion of a closed fracture to an open one, and restriction of blood flow. All three of these are no good for those situations. And I'd hate to be the guy who shows up with a closed fracture that ends up being a open fracture because I didn't take care of it properly. Excessive bleeding, increased pain, paralysis of extremity from spinal injuries, and the spine is going to be part of this immobilization. You make sure we go through full immobilization for spinal injuries as well. So in the Padlet, a few people have been talking, and in the case scenario as well, we're looking at checking pulse motor sensation or CMS, circulation sensation of motor, because the other one's referred to as PMS, and people just don't really like to use that term. But the fact of the matter is, that's what I learned a long time ago, and that's what they're doing here. Okay, assessing life threats, but also dealing with the injury they see at the leg after identifying no serious life threats necessary to deal with. They're going to go ahead and take care of the leg. So she's starting out with pulse, motor, and sensation, or circulation, sensation, and motor by checking for a pedal pulse on top of the foot. Going to expose the area so we can see exactly what we're dealing with. Any bleeds or any injuries need to be addressed, and in this respect, they're doing a little bit of pressure. Bandaged it up, and you can see they're immobilizing, holding it still, while they go ahead and use a rolled towel. And I know this kind of seems odd to create that, start creating that splint. We're using this to actually fill void space, and the cardboard splint goes around that. And what they're using here is cravats, the ties, to secure it all in place. Here's another version of that same device. This would be a reusable long leg splint. General types of splints: rigid, pressure splints, traction splints, and formable splints. And we're going to take a look at some of those. Vacuum splints, slings and swaths, you guys got a chance to work on those. Spine boards, we've done that. Improved splinting techniques. Improvise. And that is going to be using a towel, a pillow, or even a magazine. So improvising your own splint at home, or what you have to aid you in splinting that extremity. So what we're looking at here is an arm injury, obviously, and we're going to be using a vacuum splint in this case. This device goes around the arm, and he's got his hand over this valve here. There's all kinds of different types. This valve, basically, when he presses it, it's going to release the air that's inside here and tighten that splint up around. So he's released the valve, and they're going to use the pump to actually pull that air out. Here is the splint or wrap area in an ordinary bed pillow. So I don't think that's a pillow, but a blanket. And basically, this is used to mobilize an ankle or lower leg fracture. You guys can see, I mean, it seems like, a blanket is not really going to be beneficial, but once you wrap it up properly, tie it off properly, it's going to be really strong, secure, immobilizing things. Hazards of improper splinting. Compression of nerve tissue, blood vessels, delayed transport, reduced distal circulation, aggravation of the injury, excessive movement, skin damage from improper padding. Splinting long bones, basically immobilizing first. You want to make sure you keep it from moving any more than it needs to. We're going through the CMS, circulation, motor sensation, or PMS, pulse motor sensation. In this respect, he's checking for He can check for sensation by pinching like he is, and also checking for circulation too, because we're looking for a return of blood flow to the skin. Kind of unusual, but this is one of the ways in which it's done. Still immobilizing, making sure it's not moving any more than it needs to. Splint is chosen to the right size. In this case, from the fingers behind the elbow as far as you can, depending on where this injury is. I mean, if this injury isn't right inside here, we want it behind the fingers and as up high around the elbow as we possibly can. If it's a wrist fracture, from the fingers beyond to the forearm will be sufficient. Here's another vacuum splint. They're actually pulling the air out of this to actually mobilize it secure. And after it's done, going back through your PMS. Splinting a joint. In this respect, we've got a knee injury, okay? And in some cases with these joints, you really don't want to do too much movement. So we're going to splint it as we see it. This right here is hard with a cardboard splint. I've done this before, and it does not work well with a cardboard splint to keep the leg still. So these vacuum splints or air splints would be definitely a better type of splint for this specifically. And there you go, your vacuum splint, and you've secured it in place, and then checking like they did before and after. Traction splints. Femur fractures can be complicated by bleeding pain and muscle spasms. Using traction to align a femur can reduce complications. Treat for a fracture if the thigh is painful, swollen, or deformed. Do not use a traction splint if the injury is within 1 to 2 inches of the knee or ankle. The knee has been injured, the hip has been injured, the pelvis has been injured. There is partial amputation or avulsion of the lower extremity. Compartment syndrome, pressure development within the injured area. The pressure exceeds the capillary pressure needed to perfuse the tissue. The tissue becomes hypoxic, which results in further damage and swelling. Compartment syndrome signs and symptoms: severe pain or burning sensation, decreased strength in extremities, paralysis of the extremities, pain from movement. Extremity feels hard to palpate. Distal pulse, motor, and sensation function may be normal. Compartment syndrome treatments: splint, elevate, apply cold, ice packs, and transport. Now, I'm going to step back just a second because there's something that got lost, and I want to make sure you guys see it. As we talked about the traction splint, where'd it go? It's in here somewhere. Sorry, guys, give me a second. Here we go. All right. As we're talking about the traction splint, not using it on a device or an injury that is close to the hip, in the ankle, in the knee, in a joint on a lower leg, this is for a mid-closed shaft femur fracture, right in the femur, right in the center of the leg. Talks about pain coming from spasming of muscles. Your bone, your femur is the strongest bone in your body. When you fracture it, boom, it slips. What happens here, yes, this is painful. Bone rubbing against bone is not going to be nice. It hurts, okay? And the break is going to hurt. But now you have all the muscle on the outside that is now knotted up and twisted up. That's where the pain comes from. So that's what this device is for. What this device does is it allows us to take that bone, we put this underneath this portion, the ischium pad, underneath the ischium tuberosity of the rear end, basically where your wallet is, gentlemen. It goes right underneath that bone. This is extended 8 to 12 inches past your uninjured leg and then put on your injured leg. So your foot would sit right about here. This goes around the foot. This strap hooks up to the bottom of that. After attaching the ischium strap, we can then crank down and retract this strap, which pulls the leg this way. So we finally put it back in line. How do we know we did it right? When the patient no longer feels pain or has some relief. There's pain's going to be there, but the relief is setting in. After that's all done, we secure the leg with these 4 straps in the proper spots. 2 on the upper thigh, 2 on the lower leg to secure the whole thing all together. That's the traction splint. I'm going to have you guys, or I'm going to find a video that puts this all together because I think it's an important one to understand. It's the device that we need to know. So I apologize that wasn't up there with the lecture, but that is something that we need to be aware of. All right, so that pretty much clears our 30. We will have that block exam this week on Wednesday. I will have our normal meetings Tuesday and Thursday. And we have some things we need to start discussing because we're getting close to the class. Thank you very much for your time, and I'll talk to you soon. Bye.